All right, hello everyone. Thank you for joining today's webinar. We have a fantastic presentation planned for you this evening. Tonight's presenters are going to start off by sharing some timely information about how coronavirus has impacted the NCLEX, some key things for any level of student to keep in mind while preparing for their NCLEX exam, and then we'll dive into an interactive NCLEX review session. To get the most out of this session, we recommend that you are viewing in full screen and prepared to answer the NCLEX questions that are delivered via polls throughout the presentation. Without further ado, I'd like to turn it over to tonight's presenters, Elsevier authors and NCLEX gurus, Linda and Angela Silvestri.
Welcome everyone. Angela and I are so excited and pleased that you're able to join us this evening. We will be talking about the NCLEX and some important changes and tell you what you can do to get ready for that very important exam, whether you're an RN or a PN student, or a beginning student or final semester student. So now on this next slide, the NCSBN is the National Council of State Boards of Nursing, and this is the organization that creates your NCLEX test. They provide updates to nursing students and candidates about the exam. So whether you are a beginning student or upper level student, it is really important to stay informed about NCLEX updates. Their website is on the bottom of the screen, and it's www.ncsbn.org. Another important website that you need to visit is Pearson VUE. So that's PEARSONVUE.com. And this is the organization that actually administers the test at the testing sites. So as noted on this next slide, let's start off by talking about some modifications to the NCLEX because of the current COVID-19 crisis. The information on this slide is from the NCSBN webinar presented earlier this month. And according to the NCSBN, modifications were made to support the flow of new nurses into the healthcare system while minimizing the risk to test takers and testing center staff. But just know that these modifications will remain in effect until at least July 4, at which time the NCSBN will determine the need to extend the exam modification time. If the date is not extended, then the test will go back to the original plan. So this is important information for those of you who will be taking the NCLEX soon. What is significant to note here is that both the RN and PN test will be a 4-hour exam and will be comprised of a minimum of 60 questions and a maximum of 130 questions. So you can see that this has changed from the original plan. Also note that there will not be any experimental or pretest questions with the exam modification plan, nor will any of the new next generation test questions be presented on the exams for data collection. These changes, specifically with regard to the number of test questions, does not make the test more difficult. So that is important to know. And the psychometricians at NCSBN found that they can validly and reliably determine your competency with these number of test questions. Okay, so now let's talk about the testing environment on the next slide. As of April 6th, there were 134 test centers open, and there are possibly more open at this time because the NCSBN was working on opening more if it was feasible. There are restrictions on scheduling because the test centers are limiting the number of test takers per day. So what you need to remember, especially those of you who are taking the exam soon, is that not only RN and PN tests are being administered. Medical exams and first responder exams are a few of the other exams being administered at the same time. So there are other professions trying to schedule a time to test at the same time you may be. All of the CDC guidelines are being followed in the test centers, including enhanced cleaning, providing essential items, etc. Cleaning is done between each test taker. Test centers are providing essential items such as hand sanitizer and paper towels. Declaration of wellness at check-in is also being done. And in fact, they are asking candidates if they exhibit COVID symptoms in the last 14 days and asking the candidate if they have been in close contact with anyone who had COVID-19 or was exhibiting symptoms of it. Social distancing guidelines are followed, such as 6 feet distancing. Identity procedures are done at a distance, and the palm scanner used for identification is cleaned between candidates. Now, face masks and gloves are permitted, but remember that you must bring your own. These are not provided at the test center, so keep that in mind.
Okay, so now for this next slide, let's talk about you and your goals. For those of you who are beginning or intermediate students or level 1 students, you're at a strategic advantage because you have some time before you're going to be taking the NCLEX, and you can be preparing for the exam at the same time that you're studying and preparing for your nursing exams. So your goal needs to be preparing for NCLEX while in nursing school. And for those of you who are level 2, upper level, or senior students, everything that you've learned in class and clinical during your program has been preparing you for the NCLEX. And now it's your goal to put on the finishing touches of your preparation. We're going to talk about these specific strategies in a bit, but first we'd like to talk to you about the very important NCLEX test plan. So why is the NCLEX test plan so important? Because it actually lists the content and activities that you as a newly licensed entry-level nurse must be able to perform to provide your clients with safe, effective nursing care. This test plan, it tells you what you will be tested on. How great is that? So there's 2 examples on this slide here of something that is found in the test plan. The first one listed is in the safe and effective care environment component of the test plan, and it tells you about the guidelines that you would need for using ergonomic principles. So you can see that there. And then the second one listed here is from the physiological integrity component of the test plan, and it actually tells you the exact lab values that you need to know for the NCLEX. So you can see identify laboratory values for ABGs, BUN, cholesterol, creatinine, and so forth. It goes into a fair amount of detail there. You will need to know the normal laboratory values for certain tests so that you will be able to recognize if a lab result is high or low if it's presented in a question. So we highly recommend that you access the NCSBN website, download the test plan, save it on your computer or print it out, and use it as your study guide for the NCLEX. As you master each content area or activity listed in the plan, you can highlight it. And then once your test plan is all highlighted, then you know that you're ready to take the NCLEX. The link to access the test plan is here for you, so just be sure that you download the correct plan for RN or for PN, whichever one is appropriate for you. So on the next slide, we've listed the components of the test plan. There are the 3 components, which include the level of cognitive ability, integrated processes, and client needs. Client needs is the major framework of the test plan. These components are used to guide the development of the test questions for the NCLEX. So in other words, questions are written to address the levels of these 3 components. So now on the next slide, let's take a closer look at the levels of cognitive ability. Levels of cognitive ability include understanding, applying, analyzing, synthesizing, evaluating, and creating. However, it's not at all likely that you're going to encounter questions that address the level of understanding. Questions are usually written at the applying level or higher because the practice of nursing requires clinical reasoning and clinical judgment. This means that you'll be required to apply, analyze, synthesize, and evaluate the information provided in the test question. You will also be required to use the level of cognitive ability creating, such as in creating plans of care or teaching plans. Let's look at a sample question on the next slide that addresses the level of cognitive ability for applying. So I'm going to read this question and the options to you, and then we'll open up polling and you guys can answer the question. A nurse is caring for a client with a T5 spinal cord injury. The client complains of a severe headache and feelings of anxiety, and the nurse notes that the client is sweating, bradycardic, and hypertensive. Which is the appropriate immediate nursing action? 1, notifying the healthcare provider. 2, medicating the client with an analgesic. 3, checking the client for bladder distension. Or 4, discussing the client's feelings of anxiety. Okay, so looking at the results here, it looks like 71% of you chose option 3 as the correct answer, and that is correct. The question is asking you, what are you going to do? So note that this is an applying level question, and it's asking you for an action. In this question, you need to recognize that the cues indicate that the client who sustained a spinal cord injury is experiencing autonomic dysreflexia. Then you need to read every option and note that what you need to do is take an immediate action in this life-threatening situation. Recall the causes of autonomic dysreflexia, and remember that bladder distension is a cause and it would need to be corrected to resolve the situation. Also, as a side note, if you used test-taking strategies, you could eliminate option 4, discussing the client's feelings of anxiety, because this is a psychosocial action. And physiological actions are the priority according to Maslow's hierarchy of needs theory, and that's one strategy that you could apply here. And then to select from the remaining options, use the steps of the nursing process, and note that option 3 is an assessment or a data collection action, and that reflects the first step of the nursing process. Okay, so on the next slide, we have listed the integrated processes. You can see caring, communication, documentation, culture and spirituality, nursing process, and teaching and learning. These are the 5 processes that NCSBN has identified as components of the test plan and are fundamental to the practice of nursing. So what this means is that each test question will address in some way one of these components. Let's look at a sample question on the next slide that addresses the integrated process of caring. A client and her newborn infant have undergone testing for HIV, and both have been found to be positive for the virus. The news is devastating and the mother is crying. Which action would the nurse take at this time? 1, listening quietly while the mother talks and cries. 2, discussing with the mother how she contracted HIV. 3, describing the progressive stages of and treatments for HIV infection to the mother. And 4, calling an HIV counselor and making an appointment for the mother. Okay, so it looks like the majority of you, 89%, chose the correct answer, which is option 1, listening quietly while the mother talks and cries. So that's great. What you want to do is focus on the data in this question. Note that the question is describing that the mother is receiving devastating news, that she's having a response to that news. Read each option, keeping all of this in mind, and then remember your therapeutic communication techniques as well. Option 1 is the only option that addresses the mother and provides support at this time.
Okay, this next slide illustrates the client needs categories of both the RN and the PN test plan. And this information is from the NCSBN 2019 RN test plan and the 2020 NCLEX PN test plan. Now, don't feel like you have to write all of this information down, because if you download the test plan, as Angie mentioned, and as we recommend, all of the information and the percentages are going to be presented in the plan for you. So the NCSBN identifies 4 major categories under the heading of client needs: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. And some of these categories are further divided into subcategories, and then the percentage of questions on the test varies based on the category. There are a few things that we want to point out, and then we will provide you with some specifics about content that you will be asked on the exam for each of the client needs categories. And then we'd also like to present some sample questions. First, you can see that the safe and effective care environment and the physiological integrity categories comprise the highest percent of test questions. So you want to be sure that you are very strong in the management of care and in the safety and infection control areas. And with the COVID-19 crisis, you are certainly likely to see transmission precautions questions. So be sure that you are really proficient in the theory and application of these principles. Also, because physiological integrity is a high percent, you are most likely to see adult health questions. Now note that the health promotion and the maintenance and the psychosocial integrity are your lowest percents. So you may or may not have maternity questions, and you may or may not have mental health questions, but you still need to be prepared for these areas also. And remember, everyone's exam is going to be different. Okay, on this next slide, we've provided the percents for the RN and the PN test in the safe and effective care environment client needs area, and listed some, but not all of the content areas that you'd be asked about. Again, follow the test plan. These are all listed in there for you. And as noted, management of care, coordinated care, addresses content such as advanced directives and client rights, confidentiality and privacy issues, consents, assignments and supervision, and prioritizing, which is really important. Then what we want to emphasize here in the safety and infection control subcategory is that it focuses on all of the safety issues as a priority. And remember again to be sure that you understand the concepts related to transmission precautions and how, as a nurse, you would apply these precautions. Okay, so on the next slide, we have an example of the management of care, coordinated care practice question. So let me read this to you. A nurse calls a primary health care provider to report that a client with heart failure has dyspnea and that wheezing is evident on lung auscultation. The primary health care provider, who is in a hurry because of an urgent situation in the emergency department, gives the nurse a telephone prescription for furosemide, but is unclear as to the route by which the medication should be administered. Which action would the nurse take? 1, call the primary health care provider who gave the telephone prescription and clarify the prescription. 2, call the nursing supervisor for assistance in determining the route of the medication. 3, administer the medication by way of the IV route, because this route is usually used in clients with heart failure. Or 4, administer the medication orally and clarify the prescription once the situation in the emergency department has been resolved. Okay, well, from our polling, it looks like 97% of you selected the correct answer. Your answer here is option 1, calling the primary health care provider who gave the telephone prescription and clarify the prescription. For this question, you need to use your management skills to determine how you are going to manage this situation. So you need to recall knowledge about medication prescriptions and the associated legal issues. What you need to remember is that you would never give a medication if the order is not complete or it is unclear, and that you would go directly to the prescriber for clarification. Okay, on the next slide, we have an example of safety and infection control. And I'll read this question to you and you can answer it. A nurse is caring for a client who is receiving intravenous therapy through a peripheral line. Which action on the part of the nurse will decrease the client's risk of infection while receiving this therapy? 1, checking vital signs at 4-hour intervals. 2, using aseptic technique in handling the solution in tubing. 3, administering acetaminophen before changing the solution. And 4, instructing the client to push the call bell if the site gets sore. Okay, you did excellent with that question. 94% of you selected option 2, and that is the correct answer. Now, for this question, you need to read it carefully and focus on the subject and what the question is asking. The question is asking for the action that will decrease the risk of infection. So keep this in mind as you're answering. And the answer is 2, using aseptic technique in handling the solution and tubing. Many times students will want to select option 1, but checking vital signs does not decrease the risk, but it monitors for the presence of infection. So just be cautious as to what the question is asking you.
Okay, so moving on, we have listed on the next slide for you the percentages for both the RN and PN test for the health promotion and maintenance category. We've listed once again some but not all of the content areas that you could be asked about. So as noted, some of the content in the health promotion and maintenance category addresses content such as developmental stages and transitions. So growth and development concepts are very important, the aging process, normal maternity and newborn care, health screening and risk factors for disease, and the techniques of physical assessment. So be sure that you review all of these areas. And again, as we have been emphasizing throughout to this point, please make sure to refer to the test plan for the additional content areas because only some of them are listed here. So on the next slide, we have an example of a health promotion and maintenance question. A nurse in a daycare center is planning play activities for a group of toddlers. Which play materials are appropriate for these children? 1, DVDs, MP3 player, board games. 2, rattles, stuffed animals, squeaky dolls, and soft mobiles. 3, cards, Monopoly game, sewing kits, paint by number kits. Or 4, blocks, rocking horse, finger paints, wooden puzzles, thick crayons, and paper. Okay, so it looks like 91% of you guys chose the correct answer, which is option 4. So that's really good. Nice work on that. This question tests developmental stages and those growth and development concepts that I was mentioning. So when you're presented with a question like this, what you always want to make sure that you do is that you notice the age group and then think about that specific stage. So in this question, the subject is appropriate activities for a toddler. So think about these concepts and always keep safety in mind as well. And this will then direct you to option 4 as the correct answer. Note that the activities in option 1 are most appropriate for school age or adolescents. Option 2 presents items for a school age child, and these activities would actually be unsafe for a toddler. And then in option 3, it presents items for an infant. And one other tip on this, when you read a question and if an age is noted in the question, it is really important to pay attention to the age and to think about the developmental considerations for that age in order to answer correctly. If an age is presented, they're wanting you to consider the age specifically. So on the next slide, we have given you guys the percentages for the psychosocial integrity category. Some but not all areas are listed here. And so as noted in this category, you might be asked about content such as abuse and neglect, crisis, grief and loss and end of life, depression, and suicide, just to name a few. So we'll go ahead on the next slide. We'll do a practice question for the psychosocial integrity section. A nurse providing information to the wife of a client who abuses alcohol encourages the woman to attend an Al-Anon support group meeting. The wife tells the nurse that she is embarrassed by her husband's behavior and that it would be difficult for her to face other people. Which information would the nurse provide to help alleviate the wife's concerns? 1, she will not know any of the members of the support group. 2, the support group is always led by a nurse and a psychiatrist. 3, the members of the group are experiencing the same problem she's facing. Or 4, she does not need to provide her name or any other identifying information to the group. Okay, so it looks like 49% of you, it looks like we have an even split here. So it looks like 49% of you guys chose the correct answer, which is option 3. The members of the group are experiencing the same problem she is facing. And then the other half chose that she does not need to provide her name or any other identifying information to the group. So let's look at this a little bit more. What you want to do is focus on the data that's presented in the question. Note that the wife is telling the nurse that she's embarrassed by her husband's behavior and that it would be difficult for her to face other people. Keep this in mind as you're reading each option, and also notice exactly what the question is asking you. Which information should the nurse provide to help alleviate the wife's concerns? If you focus on the wife's concerns specifically, that will direct you to option 3 as being the best option to help alleviate those concerns. Okay, so next we've provided you guys with the percentages for both the RN and PN test plans for the physiological integrity categories. We've listed some of the content areas that you may be asked about. We're not going to read this slide to you, but we'll refer you once again to the test plan for specifics on this. What we do want to emphasize, though, is that this is the area that is the largest component of the test plan. Adult health is a primary focus, but we do want to point out that you will also be asked about pediatrics and risk conditions associated with pregnancy, such as preeclampsia, prolapsed cord, placenta previa, and abruptio placentae. So be sure that you read all of the activities, especially in this component of the test plan. So on the next slide, you can see an example of a basic care and comfort question, which is one of the subcategories in the physiological integrity section of the test plan. So let's look at this. A nurse provides instructions to a client about the use of a cane and watches as the client uses the device. Which observation by the nurse indicates the need to provide additional instruction to the client? 1, the client holds the cane on the strong side. 2, the client holds the cane approximately 4 to 6 inches to the side of the foot. 3, the client flexes the elbow at a 15 to 30 degree angle when holding the cane in place. Or 4, the client moves the cane and the stronger leg forward first and then moves the weaker leg forward. Okay, so it looks like we're kind of all over the board on this one, with 39% of you guys choosing the correct answer, which is option 4. The client moves the cane and the stronger leg forward first, then moves the weaker leg forward. So what's really important to note first are the words need to provide additional instruction. What you want to do with this is select the option that indicates that the client is using the cane incorrectly. You need to use knowledge of the safe procedure for use of a cane in order to answer this question. So some points here, the handle would be at the level of the client's greater trochanter, and the client would hold the cane 4 to 6 inches to the side of the foot with the elbow flexed at a 15 to 30 degree angle. The client would hold the cane in the hand on the unaffected side so that the cane and the weaker leg can work together with each step. Thus, the client needs to move the cane at the same time as the affected leg. And so option 4 is incorrect, indicating that the client needs additional instruction. All right, so moving on, we have here an example of a pharmacology question, which is also a part of the physiological integrity component of the test plan. A client with tuberculosis is taking capreomycin sulfate, a tuberculosis medication, as a component of pharmacological treatment for the disease. The client calls the nurse at the primary healthcare provider's office and tells the nurse that he's experiencing ringing in the ears. Which information would the nurse provide to the client? 1, he should discontinue the medication. 2, ringing in the ears is a harmless effect of the medication. 3, ringing in the ears is an expected effect of the medication. Or 4, he needs to speak with the primary health care provider about the problem. Okay, so it looks like 50% of you guys chose the correct option as the answer, which is going to be option number 4. This question requires you to have knowledge of this medication and its adverse effects. That's something that you can't really get away from with this. What's important to know is that ringing of the ears is an adverse effect, and that is a common adverse effect of many medications. And so because of that, the primary healthcare provider does need to know about that, and there may need to be some adjustments made based on that. Okay, so on the next slide, we have an example of a practice question addressing the reduction of risk potential in the physiological integrity component of the test plan. A client who has sustained an acute myocardial infarction is undergoing therapy with alteplase recombinant, a thrombolytic, and the nurse watches for complications of the treatment. Which assessment finding would the nurse monitor for as a possible indication of an adverse effect? 1, nausea, 2, epistasis, 3, sleepiness, or 4, P wave before the QRX complex on an electrocardiogram. All right, good. So 79% chose the correct option as the answer, which is option 2, epistasis. For this question, you do need knowledge of the medication to answer it. However, what you can do to help you is focus on the client's diagnosis, which is acute myocardial infarction. And then also note that this medication is a thrombolytic, and that information is given to you in the question. Think about the action of a thrombolytic. If you're not sure, you can use medical terminology to break it down. Thrombo means clots, and lytic means break down or dissolve. Think about what the effect might be on the body with this, and recall that an adverse effect is bleeding. And remember that epistasis is a nosebleed. Very good. So moving on to the next slide, we have an example of a physiological adaptation question, which is again a part of the physiological integrity component of the test plan. Reviewing the blood gas results from a client with pneumonia, the nurse determines that the client is in respiratory acidosis. Which data validate the nurse's findings? 1, a pH of 7.45 with a PCO2 of 52. 2, a pH of 7.35 with a PCO2 of 40. 3, a pH of 7.25 with a PCO2 of 50, or 4, a pH of 7.5 with a PCO2 of 30. Okay, great job, you guys. 91% of you got that one right. So option 3 is going to be your answer. For this question, you do need to have knowledge of normal blood gas values, and you want to note that the question is telling you that the client has pneumonia and that they have respiratory acidosis. Recall that with acidosis, the pH is below normal. And so recalling the normal pH of 7.35 to 7.45 will help direct you to option 3.
Okay, let's look at this slide and look at the types of questions that are on the NCLEX, and then we're going to look at some practice questions for each type. Now, the current NCLEX RN and PN test plan includes multiple choice and alternate item format questions. So that's what you can expect on your exam. Now, we are sure that you're very familiar with a multiple choice question, which there are 4 options and only one option is correct. As far as your alternate item format questions, first we have the multiple response. And these are questions that require selection of one or more than one option, and possibly all options could be correct. Currently, there is no partial credit given for your correct selections. So in other words, you need to be spot on with answering, and you need to do, as the question will indicate, select all that apply. Now, your fill-in-the-blank questions are questions that are going to ask you to solve a calculation, such as a medication calculation, or an intravenous flow rate, or even possibly a calculation of intake and output. These questions require you to fill in the blank with a number. And it's really important that you follow the directions provided with the question. If the question asks you to round an answer, then you need to do that. If it does not, then type in the answer without rounding. Also, if you do have to round, always round at the end after you've completed your calculation. Now, your ordered response, these are prioritization questions that require you to rank the answers in order of priority. And then your figure or image, your hotspot questions will include a figure or image, and these types may require you to click on a particular area of an image or photograph. So for example, you may be presented with an image that displays the arterial vessels of an adult client, and then you're asked to click on the area where the dorsalis pedis pulse can be felt. Your chart exhibit questions are questions that will be accompanied by a client's chart or an exhibit, such as a lab values report, that you must refer to and read before answering the question. And your audio questions will be accompanied by an audio clip, such as breath sounds, heart sounds, or bowel sounds. And you'll have headphones to use for these questions. You can adjust the volume as you like and listen to the sound as many times as you want to before answering. And your graphic option, these are questions that present graphic answer options instead of text answer options. So you would have pictures for your options. So let's look at some examples. And again, you will be provided with specific directions for answering these questions to guide you in your testing process. So just be sure to read these directions as they appear on the screen. Okay, so on this next slide, we have a multiple choice question. And it reads, in the emergency department, a nurse assesses a client with left-sided heart failure. Which finding would the nurse expect to note? Dependent edema, 2, neck vein distension, 3, abdominal distension, and 4, crackles on auscultation of the lungs. Great work. It looks like 83% of you selected option 4, which is the correct answer. So now remember that heart failure is a really important content area that you need to know for this exam. So just be sure to review it if you're not that familiar with it. And to help answer assessment questions about heart failure, just remember left and lung. Left-sided heart failure will present with lung or respiratory findings, whereas right-sided heart failure will present with all of the other findings such as edema or neck vein distension, abdominal distension, or organ enlargement. So since this question is asking about left-sided, option 4 is correct. Okay, now on this next slide is a multiple response question. Now again, with this type of question, you will be asked to select or check all of the options asked for in the question. There could be one correct answer, more than one, or even all of the options could be correct. And again, partial credit is not given when you supply some but not all of the correct selections. So again, do exactly as the question asks and select all that apply. Now, NCLEX candidates who have taken the exam tell us that they receive up to 15 to 17 multiple response questions on their exam. That's a lot. These types are very difficult to answer, but the resources that we will be showing you at the end of this presentation provide you with several hundreds of these types of questions. Okay, so aneurysm precautions. I think I need to read the question. Aneurysm precautions are instituted for a hospitalized client with a cerebral aneurysm. Which nursing interventions apply for these precautions? Select all that apply. Administering stool softeners for the client, restricting the number of visitors and keeping visits short, keeping the room well lit, especially during daytime. And I'm sorry, it's just a little screen, poll screens blocking the options. Keeping the room well lit, especially during the daytime, and encouraging restful activities, listening to quiet music. Can you possibly move that poll screen? Thank you. 5, encouraging the client to dress in street clothes and shoes every day. And 6, allowing the client to perform activities of daily living, including bathing and dressing independently. Okay, so we have 92% selecting option A and 64% selecting option 2, rather. I'm not sure if you can slide down the poll screen because I can't see the percentages for the remaining options.
I can read them if that helps.
Okay, great. It's not showing up here.
Sure. So 92% chose option 1, administering stool softeners to the client. 64% chose option 2, restricting the number of visitors and keeping the visits short. And then 98% chose option 4, encouraging restful activities such as listening to quiet music. And then there were some others that chose the other options. I just read you the ones that were the correct options.
Okay, thank you. For some reason, it's just not showing. So the answer to this question is 1, administering stool softeners to the client, 2, restricting the number of visitors and keeping visits short, and number 4, encouraging restful activities. So you did great with that. And now to answer this question, you need to have knowledge of the risks associated with a cerebral aneurysm and understand the purpose of aneurysm precautions. You also need to recall that anything that could possibly increase intracranial pressure needs to be avoided. So you would select option 1 because bearing down, as with having a bowel movement, increases ICP. And you would select option 2 because visitors could increase excitement in the client. And you would select option 4 because rest is really important to keep the intracranial pressure down. Now, keeping the room well lit is not helpful at all, and it disrupts rest. And encouraging the client to dress and perform activities of daily living, exert energy, and the goal is to keep the client as quiet as possible. Okay, so now on this next slide, we're showing you a fill-in-the-blank question. And it reads, a physician prescribes a dose of 200,000 units of penicillin G benzathine for an adult client. The label on the 10 ml ampule sent from the pharmacy reads, Penicillin G benzathine, 300,000 units per ml. How much medication in ml does the nurse prepare to administer the correct dose? And round your answer to the nearest tenth, okay? So with a fill in the blank question, and obviously you can't poll on this one, but with a fill in the blank question, there's going to be a little box for you to type in your answer, as you can see. And you only need to type a number, your answer, in the answer box. You don't have to worry about the unit of measure, such as ml, and the unit of measure will be there for you right outside the box, as you can see on this screen. And again, if the question requires rounding of an answer, do it at the end of your calculation. And the rules for rounding an answer will be provided in a tutorial that you will receive when you start your examination. And this is created by the NCSBN. You must also type in a decimal point if one is necessary. However, if it is not necessary, it is not necessary to type a 0 before the decimal point, as noted on the screen here. So you could type in either and it would be correct. You could type in 0.7 or 0.7 and you would be correct on this answer. And also remember that you do have an on-screen calculator to perform your calculations, and we highly recommend that you do use this. Okay, on the next slide is an ordered response, one of those prioritizing questions, and you won't be able to poll in this one either. But in this type of question, you're asked to list nursing actions in their order of priority. So after reading the information presented in the question, you're going to have to determine what you're going to do first, second, third, and so forth. And as you can see, the unordered options are located in boxes on the left side of the screen, and you will be clicking and dragging all of these options to the ordered response boxes on the right side of the screen. And specific directions for moving the options will be provided with the questions. Most times, these types of questions often focus on steps in a nursing procedure. So let's just read this question. A nurse preparing to suction a client who has a tracheostomy tube gathers the supplies that are needed for the procedure. Arrange in order of priority the actions that the nurse must take to perform this procedure. And it tells you that all options must be used. So to answer this type of a question, visualize the procedure. Remember to always care for the client first. So you would place the client in a semi-Fowler's position. So that would be our first ordered response. Thank you. Then get your equipment ready. So you don your gloves and attach the suction and then you turn it on. Okay, so then what you want to do is think about what happens to the client when you suction. When you suction, you remove oxygen from the client's system. So hyperoxygenate the client before inserting the catheter. And again, visualizing the procedure makes it reasonable that you would insert the catheter into the client before applying suctioning. So visualizing the procedure is a great strategy for these types of questions when you're asked how to perform a procedure.
Okay, so next we will go over an image question. So let's take a look at this one. A nurse is changing the abdominal dressing of a client who's undergone abdominal surgery. After removing the old dressing, the nurse assesses the surgical site. Which action would the nurse take first on seeing this wound? 1, documenting the findings. 2, applying a sterile non-adherent dressing. 3, redressing the wound with a dry sterile dressing. Or 4, assessing the wound for protrusion of internal structures by asking the client to cough. All right, so it looks like 53% of you chose the correct answer, which is applying a sterile non-adherent dressing. So in this type of question, You're shown an image, which may be a chart, a table, a graphic, or a photograph, and you're asked to answer a question based on that image. In some questions, you'll be asked to use your mouse to select a specific area in the image. Note that an image may appear in any type of question, including a multiple choice question, just like this one, or it could be a multiple response question or any of the other question types. So for this question, you need to use knowledge of the complications of abdominal surgery and recognize that this wound is indicative of dehiscence, which is the separation of wound edges. Next, you need to recall that what the treatment is for this complication. One of the first actions that you would take is elevate the client's head to prevent tension on the wound, which would cause further separation and possible protrusion of internal organs. This isn't one of the options, so let's look at what else is there. You do want to note the strategic word first in the question. You would document, but that wouldn't be your first action. Because our concern is possible protrusion of the internal structures, you definitely wouldn't want to ask the client to cough because that could increase that risk. So then look at your remaining options. You do want a sterile dressing, and then think about a dry dressing versus a non-adherent dressing. A dry dressing could adhere and it could cause tissue disruption or injury. And so you would select the option then that notes the non-adherent dressing. All right, so on the next slide, we're gonna go over a chart exhibit question. In this type of question, you're presented with a problem and a chart or exhibit, plus tabs or buttons that you must click to obtain the information that you need to answer the question. And a message will appear to prompt you to click on a tab or a button. So you can see that noted on this slide with the client's chart with the physical exam findings for the mouth, for the breasts, and for the fetal heart. So let's look at the question. The nurse is reviewing the assessment data on a client who is pregnant. Which assessment finding does the nurse recognize as abnormal? Click on the physical exam findings in the client's chart, and that's what we have presented here. 1, the appearance of striae. 2, pale oral mucous membranes. 3, secretion of colostrum from the breasts. Or 4, spontaneous accelerations of the fetal heart rate. All right, so 81% of you chose the correct option as the answer, which is option number 2, pale oral mucous membranes. So note that the question is asking you to identify abnormal data. That's definitely something that you want to notice. You will need knowledge of the normal findings in pregnancy to answer this correctly. Think about the normal and the abnormal findings, and then also noticing specifically the word pale in option 2 may help to direct you to that option. Paleness usually indicates anemia. Striae and secretion of colostrum is normal during pregnancy, and accelerations of the fetal heart rate are normal and healthy, and it indicates that the fetus has an adequate oxygen supply. All right, so next we will go over an audio question. So let's read the question first, and then we will click on the question to listen to it. What I'll tell you is that audio questions require you to listen to a sound before answering the question. With these questions, you're prompted to use the headset provided and to select the sound icon. You will be able to select the volume button to adjust it, as Linda had mentioned, and you're allowed to listen to the sound as many times as necessary. And common examples of these types include lung sounds, heart sounds, and vowel sounds. So looking at the question, a nurse is assessing a client's breath sounds. What sound is the nurse hearing? 1, stridor. 2, pleural friction rub. 3, low-pitched crackles. Or 4, high-pitched crackles. All right, so it looks like 81% of you chose the correct answer, which is option number 1. That sound depicts stridor. Okay, so on this slide, or the next slide, we'll be talking about a graphic option question. In this type of question, the option selections are pictures rather than text. Each option will be preceded by a circle, and you'll use the mouse to click on the circle that represents your answer choice. So looking at this question, a nurse is planning to assist with inserting a nasogastric tube. In which position would the nurse place the client for this procedure? And you would just choose 1, 2, 3, or 4. Okay, great. So 90% of you guys chose the correct answer, which is option number 1. For this question, you need to know the procedure for inserting an NG tube, and you want to think about this type of tube and what its purpose is and where its placement will be. And then looking at your options and analyzing the various positions, and determine that the best position for this procedure is going to be the high Fowler's position.
Okay, on this next slide, we want to share with you some resources that will be helpful while you're in nursing school and preparing for your nursing exams and in preparation for the NCLEX. Now, on the top left of the screen is the strategies book, and this is a fantastic resource that provides you with all of the specific strategies for answering test questions, all the way from how to avoid reading into those questions and the tips for prioritizing, all the way to the tips for answering pharmacology questions. And in this resource, there are over 1,200 questions for you to practice using all of the strategies. So if your weakness is test taking and how to answer questions correctly, this is a definite must book for you. Then you can see the comprehensive review for the NCLEX RN just to the right of the strategies book, and the PN version is just below it. And these books serve a dual purpose and are great resources while you are in nursing school and preparing for the NCLEX. These comprehensive review books contain both content presented by body systems and associated health problems, and they contain thousands of practice questions. You can select practice questions based on what you're learning in school, such as maternity, pediatrics, or any adult health system, such as cardiac or respiratory, for example. And then the next resource for the RN and the PN is the Q&A review book. And these books contain all practice questions, and they are all different from the questions in the comprehensive review books. And these questions are higher level questions that really challenge your clinical judgment abilities. Students also love this book because in addition to selecting questions by body systems, they're able to select questions by pharmacology classifications and by health problems. So for example, if you need COPD questions, you can select this category and receive all of the COPD questions that are in Evolve for these resources. And then to the far right is the online review, which is designed based on the NCLEX test plan. There are module content reviews, lots of practice questions, video lectures, self-check questions, plus much more. And this is a great NCLEX prep tool for crossing that finish line. And again, it follows the actual test plan for NCLEX. Okay, on this next slide, we just wanted to show you the Evolve selection screen that provides you with the many ways to access questions depending on your individual needs. So this is what the selection screen provides. You'll see in step 1, you can take an assessment test of 75 questions and it generates a study calendar. You can also select study mode, which we highly recommend because that will give you all of the questions in that particular category that you select, and you will receive the answer, rationale, and strategy immediately after the question, so it's a great way to study. Or you can take exams if you would like. And the testlets are actual case studies accompanied by questions, so those are available to you. And then we have audio reviews, so you can listen to content about acid-base balance, fluid and lights, or you can do a pharmacology review in an audio fashion. And in step 2 is where you would select what you want based on your needs. So you can select a specific content area, a health problem. We happen to have the alternate item format selection clicked here. So when you move to step 3, you can see all of the selections and you can select the one you want or all of them. And again, there you see the multiple response questions for you. We will be providing you with the access site for obtaining these resources. But just one thing that we want to make you aware of is that you need to be cautious about purchasing used books, because if you do, with used books, you most likely will not have the codes to access Evolve. So just be cautious about that. And Angela, do you have anything to add about this slide?
Sure, just a couple points of how I like to advise my students to use this product. Depending on where they're at in their program, I really like both the content area, which focuses on foundations of care, fundamentals, and then it can be broken down by body system. But I really also like the health problem as well, because if you're having an exam, let's say you're in a med-surg course and you're having an exam on cardiac, but you're not being tested on all health problems within the cardiac system, you can be more targeted and you can get the practice questions that are specific to those specific conditions like coronary artery disease, hypertension, peripheral vascular disease, and so forth, if you're not going to be tested on everything. That way you're not having to just bypass questions that are not specific to what you're going to be tested on at that given point in time. That was something that students had always said that they wished they had, so that way they could utilize a resource and have access to practice questions that's going to be specific to what they're being tested on. And the other thing that I would like to point out is this goes very well with using the physical book or the ebook and reviewing the chapters within that book, which gives kind of an abbreviated sort of outline based on body system. So the cardiovascular system, again, as an example, I would advise my students to go read that just as kind of a refresher from everything that they've learned to that point in a very abbreviated outline format, and then go to the practice questions and filter it either through content area by body system or by health problem, depending on the way that their course is structured.
Thank you.
Absolutely. And I did want to share just a few additional tips with you guys as well. While in your courses and while studying for exams, you should use the comprehensive review book for that brief summary, and then focus on the practice questions for those respective areas, as I mentioned. Particularly when preparing for NCLEX, it's important for you to focus on rationales and test-taking strategies. This will help improve your test-taking skills. It's really not enough just to read the question and try to choose the right answer and then move on. You really need to read those rationales. It will tell you why the correct option was correct and why the incorrect options were incorrect, as well as the strategies, which will help you to kind of use a logical way to answer the question. And when preparing for summative exams or like end of course exams, final exams, or for the NCLEX, another thing that you can do is use the top 100 drugs in the United States list that we provide for you guys in that comprehensive review book. That will help you to give you an idea of medications, because there are so many medications that you could focus on more when you're studying. And then, as Linda mentioned, the strategies book is very helpful in developing test-taking skills as well. And this resource goes into more detail about how to apply strategies alongside applying your nursing knowledge as you answer test questions. Linda, is there anything that you'd like to add to that?
No, I think you did a great job on that. Thank you.
Perfect. Okay, so then on this slide here, we have some references to the NCSBN for additional information about the NCLEX. So you guys can kind of just keep this so that you have it in your back pocket in the event that you want to look up any of the things that we referenced today in the presentation. And with that, we would like to open it up for questions and answers.
Awesome. Thank you, ladies. So the first question is, I struggle with pharmacologies. What tips would you suggest for practicing this area?
Okay. Yes, pharmacology is one of those areas that students will tremble with when they hear the word. And so a few of the things that we would say is, as Angela mentioned, that top 100 drug list in the back of the book is something you want to focus on. So that way there you won't become so overwhelmed. Also, try to get your drugs as you're preparing for your exams or for NCLEX. Try to put your drugs into a classification, because if you can get the drug into a classification and recall that piece, usually the actions, the side effects, the adverse effects, the nursing interventions, and the client teaching points are going to be all the same or very similar. So learning from a classification point of view is really, really going to help you. And the other thing is, if you look at a test question, see if there's a diagnosis in the question, especially if you don't know what the drug is, because that might help give you a clue to help put it into a classification, and that will help you answer. Or you can take the drug name and break the drug name down using medical terminology skills and try to figure it out that way. And for those of you who are getting ready to take NCLEX, and for those of you who are nursing students in school still, remember that the NCLEX is only going to present the generic name of a drug. So that's important to keep in mind as you're studying now and preparing. Anything to add, Angie?
That was great. The only thing that I would add is that in the comp book, we do have some information on general guidelines for pharmacology and some just kind of general points like not taking medications with an antacid, not taking medications with grapefruit juice. So we have kind of a nice list of some of those guidelines that you'll want to remember, because that will apply to many of the scenarios that you may be asked about with pharmacology questions.
Yes, and just to follow that up, because that's a really good point, the strategies book that we mentioned has an entire chapter on pharmacology with all sorts of tips. And every resource, you can pull up pharmacology questions and practice them.
Awesome. So we have a bunch more questions coming in. I just want to let all students know, if we don't answer your question live, we'll follow up with you at another time via email. So this next question asks, does the amount of time it takes you to answer a question on the NCLEX affect your score?
Okay, well, the answer is a no, but do you want to follow up on that, Angie?
Sure. So yes, the answer to that is no, as Linda had mentioned. There is a time limit, just an overall time limit. And so you'll have to stay within that time limit, but you can stay on a single question for as long as you need to. With that, you should remember that there's no backtracking allowed. So if you wanted to go back to a previous question, you wouldn't be able to do that, because that's not consistent with the computerized adaptive testing method that's used for the NCLEX. And the other kind of thought process on that is that as a nurse, you really can't go back and change the decisions that you've made. And so that's kind of another thing that we often say about the backtracking piece. And so if you notice that your instructors in your nursing program don't allow you to do that, then they're trying to probably get you ready for what you're going to be expected to do on the NCLEX.
Thank you. So a lot of great feedback, and this was a great review. We did have some questions though. If the questions you shared today are, quote, medium level questions or passing level questions, or how you would clarify the level of the questions that the students reviewed tonight.
Well, Angela, wouldn't you say that we had a variety from probably, well, we really didn't have any understanding questions at all. I would say they were applying or higher level questions. Some were more foundational, but some of these that we selected We added a little data in the question just to make it a little bit easier, but they're pretty difficult questions, wouldn't you say or agree, Angela?
I would agree, and I would bring you back to those levels of cognitive ability that we discussed earlier in the presentation. And none of those questions would be classified as understanding level, which are the ones that you would not be likely to see on the NCLEX. They would be applying level or above. And what I would also add to this is that the CAT approach or method with the computerized adaptive testing makes it so that this test is really an individualized experience. And so if you're doing very well and you're answering questions correctly one after another, then you might expect to see very difficult questions, right? So it really just depends. And for this presentation, I would say that none of them were understanding, but I wouldn't say that they were the highest level of difficulty either. I would say they were somewhere in the middle.
Awesome. Someone had a question about how it works taking your NCLEX if you have extended time to take tests.
Well, what you would need to do if you wanted to have that extended time is you would have to contact the Board of Nursing in the state where you are applying to seek your first license and look at their criteria for being allowed additional time. And then there's an application that you need to complete. And once that gets approved, it goes to the NCSBN, and then they'll provide their approval and provide extra accommodations for that person.
Wonderful. Have another question here. We know you mentioned the NCSBN test plan and several good study materials. How would you recommend using that test plan alongside the study material?
Do you want to answer, Angela, or I can? It's up to you.
Sure, I can start and then I'll have you chime in, Linda.
Okay.
I think that's a really great question. I really appreciate that question. So what I would do is, again, print it out or save it or whatever, and then kind of develop your method and your timeline with how you want to address those activities noted in the test plan. And then I might, if I were using, let's say, one of those evolved resources, I would then maybe draw a connection to which question category within those evolved resources would address that area on the test plan. And then once I've gone through those questions, then I can say, okay, I've studied that area and I could go ahead and cross it off or highlight it. Linda, what do you think?
Yes, I agree. And we've really designed these products in line with the test plan. So, for example, if the test plan said something about tracheostomy care, you will be able to go into the Evolve site under Foundations of Care and pull up skills, and you'll be able to find questions related to that content. And also in the comprehensive review book, I would definitely go there and review the content there. And you can always go back to your course textbooks if you still need additional information or you need to strengthen yourself a little bit more in that area.
Awesome. So we have several questions, and this is really an opinion from you both as educators, but a lot of students are wondering how many questions a day you would recommend them practicing and how they could create a reasonable structured study calendar to prepare for that NCLEX.
Okay, well, we usually advise, and you know, this number has gone up in the past few years based on the difficulty level of the exam, the NCLEX, but you need to practice 3,000 to 4,000 questions before going into that NCLEX examination. Would you agree, Angela?
Absolutely, I would agree. And whatever that looks like for you based on your individual study habits and what's going to promote your success in terms of how you could really spend that time. So for somebody, it might be that they can do 200 questions a day and really be paying attention and learning from doing that. And maybe somebody else can do 300 questions a day. And so, you know, so you really need to kind of determine your test date and then work backwards from there in developing your study approach.
Yes, and just to add to that, the best way to prepare for the NCLEX is by questions and answers. Okay, don't think you're going to be able to go into your med-surg books or your maternity books or whatever and read them again from cover to cover, because you've already done that, hopefully, and that isn't the way to prepare for this examination. What you need to do is question after question after question. We would highly recommend you take the assessment tests on Evolve for each of the products. It'll provide you with a study calendar, and follow that study calendar. And you probably already know where your weak areas are for content. So always start with those weak areas, really strengthen them. So practice questions. If respiratory is your weakness, pull all the respiratory questions and try to strengthen yourself there. So practice question after question after question. And when you get into NCLEX, it's just going to be another day of practice questions. And if you can look at it that way and stay really positive, you're surely going to be successful.
Wonderful. Well, there are several questions asking about where we can purchase this books and a discount. And I'm happy to say that if you are a US-based student who joined us today, we will be sending a follow-up email to you with all of the books that Linda and Angela mentioned tonight, along with links to purchase them on Evolve to use those valuable online resources that come with those.
Great.
I know we're over time, so I'm just going to pick one or two more questions.
Okay.
We will offer more sessions again later, and you stay tuned by following our social media channels for updates on that. Some of these questions, I'm not sure if you guys would know the answer to, such as how long most backlogged, or how long the testing centers are backlogged right now, or how long students have to wait for a test. I think that depends on the region the student is in. But could you answer if there's a way to tell which testing locations are open?
Yes, when you go in to schedule your test, you will be provided with a list of testing centers in your geographical area where you would like to test. And what you need to do is you need to click into that list to find out which ones are open. And that is how you will find out at this point. And again, they're trying to open more and more centers to accommodate all the graduates, because they really want to get the graduates out there into the workforce right now. And do you have anything to add, Angela, to that?
Yes, I do. I would like to just add, depending on the state that you're applying for licensure in, there are many states that have regulations for something like an interim permit. And this is something that in many states it's existed for quite a while. It's just not having to be used very often because of how quickly candidates typically are able to get their NCLEX done. And what that means is that you would work as a graduate nurse rather than a registered nurse or a practical nurse under an interim permit until you are able to take the NCLEX. And so just the state that you are looking to apply to for licensure, take a look at what they may have in place with something for an interim permit.
And the one other thing also is, for example, if you registered to get your license in Nevada or Massachusetts or Rhode Island, whatever it may be, you don't have to take the test in that state. You could apply for a license in Nevada and decide to take a trip to Hawaii and take your test in Hawaii. So you don't have to be in the same state. So look around to all of the testing centers available in your geographical area in order to find a slot for yourself to schedule the exam.
Wonderful. And then our last question, a very common one we hear from students all the time. Do they need to know both the brand name and the generic name for drugs on the NCLEX?
No, on the NCLEX, the generic name will be the only name on the exam. There will be no trade names. So while you're in nursing school, for those of you who are still in nursing school, and for those of you who are getting ready for the exam, focus on learning those generic names. So you would see, and we showed that in our questions this evening, you would see furosemide, you wouldn't see Lasix, okay? So that's the way the exam will present the question, generic only.
Wonderful. Several other questions here in the Q&A box from students asking questions that are state specific or about their local testing centers. Again, we would refer you to the NCSBN website for more information, as this can vary based on your geography.
Thank you, everybody. We really appreciate the time that you took to spend with us this evening, and we wish you the very best of luck. Stay safe and have a great night.